Dignitaries continue arriving at the KICC for the second day of the Africa Forward Summit. Heads of state and other dignitaries, including heads of big organizations like the WHO, are there. That's the president of Madagascar arriving there. A few minutes ago, we saw the arrival of Paul Kagame, the president of Rwanda. Remember that this summit has brought together over 30 heads of state and governments from Africa, and of course, the French President Emmanuel Macron. They'll be discussing a lot of issues, a lot of things, including climate financing, trade deals, both bilateral and multilateral. And this is a main focus in Nairobi right now, with most roads closed. Zambia's president. President of Zambia also arriving there. And we do expect his host, William Ruto, will also be there. Hakainde Hichilema is the president of the Republic of Zambia, and he's just made his arrival at the KICC. All right, good morning once again. My name is Freddie Ndimuli. This is TV47 Breakfast, and as we had promised earlier, we were going to be having a conversation about the International Day of Nurses. Yes, today being May the 12th, it is the International Nurses Day, and the theme of this day today is Our Nurses, Our Future, Empowered Nurses Save Lives. For this conversation, we are very much privileged to have with us in studio Susan Wakarugi, who's Wakaruge, who's the Chief Nursing Officer, the Nairobi West Hospital. Karibu sana, Susan, to TV47. Now, and happy International Nurses Day as well.
Thank you. Thank you. That is our pride.
Yes, indeed. Now, what does this day mean to you? You've been a nurse for a while now to get to the level you are in. What does this day mean to you?
Wow. What does Nurses International Week mean to me? Mm-hmm. It means quite a number of things. Number one, it means a profession that saves lives, mm-hmm. and a profession that forms 60% of the workforce of this country, mm-hmm. Kenya.
All right.
Yes.
And even within the medical practice, do nurses feel unappreciated? Because they also make the majority of the workforce within that profession alone. Do you feel like people pay attention to nurses enough, even in the Kenyan context?
My answer is yes and no, because number one, self-motivation is what drives a nurse. Mm-hmm. Because naturally, if you're not self-motivated, if the motivation is not coming from within, you can actually collapse. Mm-hmm. And one of the professions that can collapse because of that kind of scenario is nursing. Mm-hmm. You will hear most of the times people say, my nurses, mm-hmm. that nurse didn't do this, that nurse didn't do the other. But there is a reason behind all this. Fred, I want to tell you that in this country, we have, the recommendation is 25 nurses should take care of 10,000. Mm-hmm. population. It is the opposite in our country. It is 12, actually less than half.
Below half, yes. Below half.
So this is a nurse who experiences burnout, frustration, mm-hmm. Sometimes feels unsafe, because when you have workload that does not match the staffing, mm-hmm. there will be risks. Yes. And for a nurse, risk to do a mistake to a patient can mean a life. Mm-hmm. So those are some of the things that along the way I would want to recommend to mm-hmm. the government, public institutions, private institutions, mm-hmm. to really check on patient-nurse ratios.
The ratio.
Yes.
Yes. Now, for anyone who's visited a public health facility in Kenya, mm-hmm. it is not a place many would want to even spend a lot of time, yet nurses are there 24/7. How is it? How do they cope even working in such conditions?
Well, what actually drives the nurse is the recommitting every day to save a life. And secondly, we practice under oath. So when I qualified as a nurse, I took an oath using the Holy Bible that I shall do no harm. And that is a driving force for each nurse. So, well, nursing is not just a calling. It's a profession.
Yes.
And it should be respected as such. You see, if you give a nurse enough staffing, you give her equipment. For example, there is a patient who needs oxygen. If I don't have oxygen, what will I give? If the oxygen is not running, what will I give? You see what the nurse goes through.
Yes.
But the nurse will run either to ICU or HDU, get oxygen, come and start it, or transfer the patient to ICU. So a nurse keeps releasing adrenaline every time on shift. But they don't give up.
Yes.
They keep showing up on shift.
Yeah.
But the kind of life that a nurse leads, if it was to be understood, they would be appreciated better in form of staffing, in form of salaries, in form of recognizing the skill. Because to be a skilled person, you need to go back to school. For example, today we have a lot. For example, like if I can talk about the hospital that I work in.
The Nairobi West Hospital.
The Nairobi West Hospital.
Yes.
We saw the need, especially during COVID. And what did we do? As a team, through our leaders, we started critical care nursing. Now, I know Kenyans know that the Nairobi West Hospital is the leading hospital when it comes to cancer treatment. Because number one, we have the best PET scan, which is AI enabled, the best MRI, which is AI enabled. And for this, you have to build capacity. How do you build capacity? By training.
All right.
So we started training. So we train oncology nurses, we train critical care nurses, we train nuclear medicine through collaboration with the Nairobi University. And that's the way you make it lighter for the nurse.
Yes.
To appreciate being a nurse and enjoy being a nurse.
You said something very curious, that
Yes.
you train nurses in oncology and different ones.
Yes.
And to most Kenyans, a nurse is a nurse. We know sometimes doctors specialize. Is there specialization when it comes to nurses as well?
Absolutely. Absolutely. And Fred, let me tell you something. The nurse is with the patient 24/7. A doctor comes, reviews a patient, and leaves. The nurse remains with the patient 24/7. And that is why 80% of the delivery of service is done by the nurse. The doctor will come and order a drug,
Yes.
will come and order a procedure to be done or an investigation. It is the nurse who plans and organizes it and executes it, and even calls that doctor to say, we have done the CT scan, this is what it is reading, what is the next plan of action. So to say, the nurse actually manages healthcare system.
And has to be an expert in that particular...
So for that to happen,
Yes.
you will find that we train and become a basic nurse, either through diploma or through degree. Then after practicing, say, for 1 year or two, you go back to add your skills, depending on what path you choose.
Okay.
I chose critical care and cardiac nursing. Then I got restless. I also went into perioperative, which deals with the surgery. So when you specialize in those areas, you become an expert.
Okay.
And you mentor the incoming junior nurses. And you lead when it comes to, you become a point of reference.
Yes.
When there is need to advocate for a patient.
Okay.
And advocate also for the team.
Help me understand, because you've mentioned something about your level of education in nursing.
Yes.
How many cadres, how many classes of nurses do we have? Because we hear about registered nurse and we don't understand, why is this one registered? Does it mean the rest are not registered? What does it mean? How many classes of nurses do we have, and what does it mean? Is it because of the level of education or training?
Okay, Fred, let me take you back a bit from Florence Nightingale, who is actually the founder of modern nursing. And actually today is her birthday. Happy birthday to her.
That's why this was named International Nurses
Oh
Day.
yes, oh yes.
In honor of
honor of Florence Nightingale.
Okay.
So we have evolved over time. with the, of course, with modernization. There was what we started like informal training. Then we went to formal training. And in formal training, we had a certificate nursing, which was enrolled community nurse or just enrolled nurse. Then we went to, and their scope is very different. And then we went to registered nursing diploma. Then with the time we went to registered nurse degree. And then from there, you specialize. So from enrolled, you can upgrade to an RN through diploma. Then from diploma, you can also upgrade to a degree. Or depending on your performance at Form 4, you can enter degree program direct.
Okay.
You get? So a degree is more superior. But unfortunately in this country, and I want to say it without fear of any doubt, that you find a diploma and a degree being paid the same.
So when you hear about a registered nurse, we could have a registered nurse diploma, registered nurse degree, but telling the difference could be a problem. That even the profession itself or the hospitals themselves sometimes pay these two different people the same, despite this one having a higher level of education.
If you look at the curriculum, it's different. A degree nurse has covered quite a bit, especially in leadership and critical nursing.
Okay.
Is a critical thinker when it comes to patient advocacy and patient care.
Okay.
You get? The exposure is quite different. Yeah.
Right. Let's go back to the theme of this year's International Nurses Day. Our nurses are future. Empowered nurses save lives. It is this word empowerment that I want to understand. What does it mean to a nurse to be empowered? What kind of empowerment are we talking about? Is it just the level of training, or what other kind of empowerment do we mean when we talk about nurses?
When you talk about empowerment, it runs deep. Nurses want to be involved in the decision-making table. At a very high level. The nurse must be there in policy making for nurses, because a politician cannot make policies for nurses. A doctor cannot make policies for nurses. You need the nurse to be there because the nurse understands what is required in nursing. And so when you say you want to empower a nurse bottom up and up bottom. That way, the issues will be dealt with, and the issues are many. They involve recruiting, retaining, protecting that nurse, equipping, you get, and involving them in decision making. So when we talk about recruiting, we will deal with shortages of nurses. Recruiting means you need to train more so that you can have a pool to recruit and engage. When we talk about retaining, our nurses go out of the country for greener pastures, for better pay, because back home, they don't feel appreciated as far as salaries are concerned. Like if I'm a critical care nurse and I am still struggling, and I know if I go to UK or to US, the remuneration is much better, maybe 10 times, the nurses will go. So we are training and they're taking off. So we need to retain them by paying them and recognizing their added skills. Okay. The nurse needs to be protected. How? You have heard, Fred, of nurses who have been abused? In
hospitals? Emotionally
and physically, yes. There was a year that a nurse was even shot by an armed patient. Nurses are abused, even verbally. Nurses need to be protected for them to be able to deliver without fear. There are some nurses who know that I am going to nurse this patient, and they know how the relatives are. They are filled with fear. And showing up for shift, they are not themselves. They are filled with fear. And with fear, it impedes your performance. You get? So protection is one thing. The other protection that nurses need is mental health. The nurse goes through a lot. I am the one who is with the dying patient. I'm a human being. Yes. I am drained emotionally by seeing that death because I have connected with that patient. We have a relationship. Sometimes we cry and they're not our relatives. Yes. So the nurse needs mental health. So
Is that an area you feel that the government of Kenya probably has even focused, or even the unions that represent nurses in Kenya, do they talk about that much, about issues around the mental health of their members?
No, it is forgotten. I can sit here and tell you it is forgotten. When a nurse does not show up for shift, there will be a lot of blame. Instead of finding out, maybe they just didn't have the courage to show up for that shift. They're undergoing a mental deterioration. That is a nurse who needs to be held up, lifted, and attended to like any other patient. So nurses don't feel protected as far as mental health is concerned. And you know, for a patient to abuse a nurse, or relatives to abuse nurses, that drains them. After I have given all to the patient and their relatives, and then this is what I receive, it affects their mental health. And this is not addressed, both at government level and even at private level. But I want to tell you something about the Nairobi West Hospital. The Nairobi West Hospital has recognized this need, and what have we done? We have engaged chaplains, both Muslim and Christian, and we have clearly displaced given numbers to our staffs. So when they are in need, they can access counseling, they can access spiritual counseling, because that also matters. Before you blame a staff for absenteeism, we normally call, and we want to understand, and we tell them, come, we talk. I will talk with them in my office. If it is a need that I feel HR should come in, I invite the HR, and we refer them for counseling. We have hospital counselors, clinical psychologists, who we refer our staffs to, and they get help. So this is what I would want done and duplicated everywhere. And that has given us a very strong nursing force at the Nairobi West Hospital.
I don't know how long you've been at the hospital you work for right now, but if we may go back 5 years to the period of COVID, the pandemic, and as a critical service provider, the nurses didn't get to go home and stay because of curfew. They had to still keep on doing their jobs at in hospitals. How draining was that? What kind of impact did that have, especially in the Kenyan context, even within one institution? If you may go back and say, okay, fine, this is the impact this pandemic had on our nursing population.
The impact was great on the nurses especially, and I was one of them. I joined the team. You know, during the COVID pandemic, there was nothing like chief nurse or normal nurse. All of us became nurses because there was need. And I can assure you we slept in hospital. But we created time to debrief and talk about it, because we lost patients. And that's life. And we are committed to save lives. When you fail to do it, it drains you emotionally. So, and actually that informed the decision to start a school in Nairobi West during COVID time. I joined the hospital 2020, so COVID found me there. And I remember going to Nursing Council countless times so that I liaise with them to allow us to train. And I want to thank the Nursing Council for allowing us to train. They have been very supportive to the Nairobi West Hospital in terms of capacity building as far as nursing is concerned and other trainings. And that is how we started the school.
What need is this that you saw for you to find it crucial to have a school?
We didn't have the skill. We didn't have critical care nurses. COVID calls for critical care nursing because it is a disease that affects the systems, and a basic nurse cannot cope. So you need critical nurses to work with intensivists in ICU. You know, COVID, most of the patients went to ICU or in isolation, where you needed the skill on how to do things. That you cannot put a novice nurse.
What about the level of risk? Because I understand many medical practitioners got infected in the line of duty.
The risk was real. The risk was real. I lost a nurse who I was working with, and not one, I think we lost 2. I got COVID twice myself.
Wow.
And I think the second one was bad, but I thank God I'm alive. So when we talk about nursing and we talk about protection, The nurse is always at risk of contracting diseases from patients, TB, COVID, hemorrhagic fevers. And you see, ours is an obligation and a commitment we can't run away from. So you cannot shelf off the patient and say, I will not go so that I don't get infected. But what there is, provide the tools. Okay. Provide protective personal equipment, like gloves. Like COVID, during COVID, the Nairobi West was very generous in giving us those COVID suits. I remember wearing them. They were white in color. So when you protect the nurse and give the tools to work, provide oxygen to give these patients so that they don't die. COVID patients, what we needed most is oxygen because they were lacking oxygen. And of course the drugs. And that we got. So you provide protection in terms of gloves and everything that needs to be used. And then you provide the drugs. And then you provide the environment that is safe. And then you reward these nurses by not giving them gifts, even rewarding them publicly. Well done. You're a great team.
Recognition.
Recognition.
Yes.
They go a long way.
Yes. But now, because in your line of work and you are a senior nurse right now, you may have worked in a public institution.
Yes, I did.
Yes. How was that experience? Because now you talk about the provision and how probably the institution you work for right now has been able to empower the nurses. How was the situation back then when you were probably working for a public institution, for a nurse?
Fred, you really want me to discuss that?
I want to know the plight of a nurse working in a public health facility in Kenya.
It's pathetic. It's pathetic. And I will tell you why I left public to private, and I have never regretted. I'm a very emotional nurse when it comes to patient care. And there was this one time, a 15-year-old was brought with a growth on one of the breasts. She was being helped to carry the load of the mass, the growth, and was brought at the receiving area. I was working in theater in that hospital, which will remain unnamed.
But it was a public health facility.
Yes. And that case was cancelled.
They did not proceed with the surgery?
They did not proceed with the surgery. Reasons? There were so many things that were not available. Stockouts, unavailability of manpower. There was a list of what was not available, and so that child was returned back to the ward without surgery. I cried. I went to the changing room and I looked myself in scrubs and I asked myself, Susan, this is what you want to do the rest of your life? I said, no. No. Wow. And I made a decision. I will work in private hospitals, and I've been in private hospitals, and God has helped me to reach the level I've reached, and I've impacted on nursing. Yes.
Right now there's a risk of hantavirus. Possible pandemic.
Yes.
Yes, and even as we continue with this conversation, the Africa Forward Summit continues at the KICC and will periodically keep going back and forth to that event. Let's show you some of what is happening right now, even as dignitaries continue to arrive.
Okay.
May I request that we may now take our seats?
Puis-je vous demander, mesdames et messieurs, de
Your
bien vouloir vous asseoir.
Excellency Dr. William Samoei Ruto,
Excellence,
President and Commander-in-Chief
Monsieur
of the
le
Kenya
Président
Defense
et
Forces,
commandant en force des
Your
forces armées
Excellency
kenyanes,
Emmanuel
Monsieur
Macron,
William Ruto,
President of
Excellence
the
Monsieur
French
le Président
Republic,
Emmanuel Macron,
His
Président de la
Majesty
République
King Letsi
française,
III, Kingdom
Sa
of
Majesté
Lesotho,
le roi
Your
Letsi
Excellency
III,
Paul Kagame,
le roi
President
de
of
Lesotho,
Rwanda,
le président
Your
Paul Kagame,
Excellency
président du
Alassane
Rwanda,
Ouattara, President
Votre Excellence
of Côte
Alassane
d'Ivoire.
Ouattara.
Yes, that's the Africa Forward Summit. The President, William Ruto, and some of the guests, including French President Emmanuel Macron there, ready for today's session. Quite a number of heads of state from the African continent are attending and will be going back shortly. But I'm still in studio with Susan Wakaruge, who is a Chief Nursing Officer at the Nairobi West Hospital on this International Nurses Day. And unfortunately, we do not have much time because of that event at the KICC, but I'd like to finish with you. Just talking about the hantavirus. Now, the lessons you learned from COVID, now on the Nairobi West Hospital, you say, given the kind of training you've taken the nurses through, you're ready for anything?
Yes, we are ready for anything, and we have the infrastructure that we can handle that, just like the way we handled COVID. By the way, Fred, are you aware that the Nairobi West Hospital was widely recognized, that any test that was done at the Nairobi West Hospital was recognized in every country that you needed to travel? And so we received a lot of clients who were en route or who needed testing, and they were considered as legit results. Now, the other thing that I want to tell you is that when a disease like that comes up, we start training our people, and we start making posters of guiding even clients who come to our hospital. This is what you are required to do for safety.
All right.
Yeah, you will find that a lot in our hospital when you visit. Now, the other thing that I also wanted to let you know, Fred, is that the Nairobi West Hospital is actually a specialty hospital. We are the only hospital that does bone marrow transplant.
Okay.
Why bone marrow transplant? We realized that there was a load in this country of multiple myelomas, leukemias, and sickle cell. So for sickle cell, we are doing red blood cell exchange, and we are really impacting on our people.
Yes.
And we have even started a partnership with Jaramogi where it is endemic.
Okay.
Now, we have had quite a number of bone marrow transplant
Because of time,
cases.
we might not be able to go through all that, unfortunately.
Okay.
But I would want you to use about a minute for that, and as you give us your parting shot, even to all the nurses on this International Nurses Day, even as you wind up your statement. Continue.
Okay, what I would want to tell the nurses of this country is that we value them, we appreciate them, and I would want to urge them to be professional, and sky is the limit. Let them add skills and impact life. And nursing is the only job where you're paid to earn a blessing or a curse.
Wow.
It's a choice, and choices have consequences. I choose blessings, so I will do good, I will do no harm, I will give the best quality care to the patient.
Wow.
Yes.
That's profound. Thank you so much, Susan Wakaruge, Chief Nursing Officer at the Nairobi West Hospital on this International Nurses Day, giving us an insight on what a nurse goes through and what they do at the Nairobi West Hospital to empower the nurse, because the theme of this Nurses Day is empowered nurses save lives. Well, we need to go back to the KICC for the Africa Forward Summit, where President William Ruto and the chief guest Emmanuel Macron, the French president, are currently going on with the sessions this morning. Good morning.
J'ai le très grand honneur et le privilège d'être la modératrice de la séance d'ouverture de ce sommet, et permettez-moi, par commencer, par exprimer mon appréciation aux deux pays qui nous reçoivent, Son Excellence Monsieur Emmanuel Macron, le président de la République française, et Son Excellence Dr. William Ruto, qui est le président de la République du Kenya. Voilà. S'il vous plaît, veuillez applaudir nos deux excellences pour leur leadership et leur engagement vers le renouvellement du partenariat entre la France et l'Afrique basé sur le respect mutuel, la coopération mutuelle et une prospérité partagée. Veuillez applaudir, s'il vous plaît.
Excellencies,
Excellence, nous sommes réunis ici à un moment qui va définir l'histoire.